First of all, thank you, Dragosh, for inviting me. So I'm Nassim Tayari. I'm a data scientist at RBC currently. It's been a while, like 10 months now. And before that, I was a research scientist at a hospital back in Netherlands. So I moved from Netherlands almost a year ago to Canada. The hospital that I was working was like actually a medical research center, or medical center. And that's why like I think I have some connections to the healthcare. And back in December, but in the Future Makers talk, I gave a talk about the healthcare, AI applications in healthcare. And this is kind of, this presentation is kind of following that presentation. So on that talk, I mostly talked about the research phase of AI, machine learning, and deep learning. And now I'm going to more talk about the present status of AI in the medical products in the market. So if I want to, let's say like start with the AI market size, and as all we know is on the growth. So it's based on the. Just a second. No problem. Okay. Oh. Okay. Yeah. Okay. So actually, it is the AI market size is expected to be towards $4 billion, and it's like based on all the statistics, it's going to be $60 billion, and that's a lot. Like that's a big growth. And you can see like that it has been projected in so many different industries, and it's not all only about the IT, like IT companies, but also you can see that like for example, the financials, the fintech section, the consumer discretionary, manufacturing, and telecom. And it has a very small share in healthcare, mostly in the research phase. But we have seen, but based on considering so many difficulties for a medical device to get into the market, this 3% is increasing more and more. So what I want to talk is that part of this talk is also inspired by, I was listening to a session at a European radiology conference, European Conference Radiology back in early March, and they were talking about if AI and healthcare are a perfect match, or is it like is a painful divorce? And what I like that's why it inspired me somehow to see like if it's the relationship between AI, machine learning, and healthcare, based on all those discussions and the controversial discussions actually between like AI and radiology, AI and pathology, and all those clinicians around. Is it a healthy relationship? It's very important to build a relationship that works. So I want to start with the very first article about in radiology, that they started to analyze the images, the X-ray images. This goes back to 1963, and it was like more like rule-based systems that they used to hand design features. Like they had some kind of filters, and then they used those in order to somehow find different, let's say tumor. And then they moved to the classical machine learning models, early 90s. And still they had the hand design features, but they were trying to use models in order to map from features. And then later on, the hand designed features were replaced by extracted features, but still the humans were involved in order to somehow decide on the deterministic features. So then the deep learning the deep learning idea was goes back to 70s, but then they in late 2012, early 2013, they started to use deep learning in medical applications. And this is not a deep model, this is just a simplified one. And as you can see that there are so many neurons at the input level that they try to cover the image, and then to further go in deep into the model, we have a higher perception, so lower dimension and higher perception. But so in the very first phase, from 1963 to 2013, they were trying to build the systems in order to automate the analysis of the images. But like most of those models were failed. But comparing the performance of those models to the humans were better. So the patients and also the clinicians prefer to go to the humans to scan their models, scan their images and read them. But the deep learning idea back from 70s started to work, not only because we have better computers or processing units, but we have more digitized data. And so they have more data to train the model on. And then of course, there are improved algorithms to train the network. So, and like this is like a pretty recent tweet, I guess. I can hardly remember, like, I guess I missed. Yeah, not recent, like a couple of years ago. But in which Andre, the co-founder of Coursera, said that pretty much anything that a normal person can do in less than a second, now we can automate with AI. So, and then he continues on the comments that, like, if you have a classification task or a detection task, that like a radiologist or a human expert look at the image and then try to identify whatever it is in the image in a second, a computer can do it faster and with higher accuracy. So there is a tipping point here. So we do not want actually CAD systems, computer-aided diagnostic systems, not only to help the occasions that the human reader make a mistake. So what is the point? Just to use that models for this specific, for the task that mostly the human can perform better, and sometimes there are some mistakes. And also, we do not want to train the experts, because training them is very expensive, like a trained radiologist, and it's very time consuming. So then again, there is no point in training the humans to do the things that a computer can do it better. So there is always this weighing here. And I don't know if you're familiar with if you have ever read the Hugh Harvey's blog, but yeah, I admire him. So he's a radiologist, and also he has a PhD in I'm not quite sure about computer science or math, and then so he's like, I mean, he can talk on behalf of both sides. And then on this blog he just discussed about if the radiologists are going to be replaced with AI, and then he started that with the point that when Jeffrey Hinton started, the godfather of neural networks, I'm 100% sure that you're familiar with him, but he said that he mentioned that it's quite obvious that we should stop training radiologists, as image perception algorithms are very soon going to be better than humans. So he thinks that they are the coyotes already over the edge, and they haven't looked down yet. And Hugh Harvey thinks, and I also do agree with him, that this kind of raised the expectation of the AI community, deep learning community. Everyone started to wait for the point that the deep models started to replace the radiologists, which hasn't happened. And I mean, I'm not quite sure if it's going to happen anytime soon. It's going to take time, and it's not going to be in a swim. So, so let's say if any system, any model, any algorithm is going to replace a like a person, but like we know that every job has different aspects, so it's not just processing the data. Oh, I think.
Yes.
No, it's working. So it's not just processing the data, but it has different components. Like a person, thank you. A person learns new things to acquire expertise, or they have to interact with others, and they have to be creative. These are the parts that they are hardly replaceable by a model. So, and we think that most of the professions have a little bit of everything. I don't know what happened. So the AI is going to mainly used for the automation of certain tasks, not all of them, and it's not trying to replace the professions of those experts in one sweep, and it's going to take longer than one expects. So this kind of means that the radiologists who work in dark rooms, or the pathologists like always looking into to their microscopes, they are more going to be data wranglers rather than becoming someone who is just looking into the image, radiology image, or the pathology. So they are going to step out of their dark rooms and they try to sign off the reports by the help that they are getting from those models. So I want to somehow summarize the computer-aided diagnostics, the CAD product landscape into 3 categories. So there are some products out there that are being used that they are trying to replace. So there's very easy tasks that it can be easily replace a clinician or a human reader. And I'm going to call it AIR from now. There are some products that they are help with the task in order to do it more accurate, faster and less tedious. So they are assisting. And there are products that they are extending the performance of a clinician. So they are doing something that the clinician is not doing right now, and may never be able to do in the future. And I'm going to bring you some examples of each category. So first I'm going to start with the AIR. So like the products are at this stage that they are already replacing. I guess it's a Danish company. Introduced it was called started in 2009. It's called Bone Expert, and they provide a software for bone age determination from hand X-rays in children. So as you can see in the image, that there are some scoring on the image. So using the X-ray images, they look at the software somehow analyze the image and provide some score of the bone. So comparing to the cancer cases, it's a very low risk use case. So and the quality of the data is X-ray, and now thanks to the technology, we have high quality data. It's a very difficult task for humans because it's a quantification task, looking into the images and trying to quantify. And it's very time consuming to obtain the best accuracy. That's why this product became available on the market since 2009, and is already integrated in the PACS system. It's FDA approved and CE marked, and is being used in more than 110 clinics around the world. So just comparing how it made the life of pediatrics and also radiologists easier. Comparing the performance of the model and clinical pediatric fellow, it helps to save time 18%, or when it gets to the radiology residency, it's even higher, and it saves their time 40%. So when they had a survey after a couple of years, and they figured out that Bone Expert is being used as a second reader in 10% of the time and an assisting tool in 40% of the time. But in so many centers, they only use Bone Expert standalone. So the moment that there is an X-ray of the image, X-ray image of the hand, the report immediately goes not to the radiology to sign off, but also directly to the treating clinician. So it's kind of like in 2 minutes or 3 minutes, the report is ready out there. This is another example of the actually product replacing the human in radiology. It's called a CAT for TB, and it's a software to analyze the chest radiographs in order to detect tuberculosis. So the software produces heat maps and also scoring that in different centers, in different parts of the world, there are different thresholds for this scoring in order to somehow select the people in risk of in risk of the disease. So there is this gene expert bacteriological testing for those people. So the first version was released in 2011, and it was immediately used in Zambia. So even without any certification. And the only reason was that there are no radiologists there in order to look into those images. So there was a high demand for such a thing over there. We do not, when you don't have any other option, you don't wait for the standards to come and then to help you with that. But they started immediately, and also in Nigeria. And now, I don't know if you're familiar, but in Nigeria they have the highest rate of tuberculosis. But then, fortunately, the fourth version in 2014 received the CE marking, and the sixth version is based on deep learning. Now they have it on the box and also on the cloud. So there are people, like technicians in those regions, that they just upload that into the cloud, and anywhere around the world can just double check. There are already 150 stuff. This is the data that I just collected 2 weeks ago, so maybe it's even more, but 150 installations in 24 countries. It's not FDA approved, so they are not using it in North America. Now switching to AIA, the products that they are assisting, so they are not replacing yet, but they are assisting. There is software, this lung cancer screening software, which is both CE certified and FDA approved. So it helps to detect the nodules and also assess based on the lung RAD assessment for lung cancer screening. And this is a very I worked with these people, so it's a very time-consuming task for a clinician, actually for a radiologist, to look into those images and try to manually delineate all those regions. And this one actually helps them in order to somehow at least assist them with time. Another one is this is quite new. It's a spin-off in Netherlands also again. So they have this deep learning based software that they detect, track, report all the nodules, the pulmonary nodules on volumetric CT chest scans, and this is also CE marked, so it can be used in Europe. But let's move from radiology to neurology. So because there are some tasks that the radiologist just sign off, but the report needs to be approved by the neurologist. So this is another software that implements this is aspect scoring system on stroke CT scan. So it is CE marked. It's a class 2A certified medical device. And actually, it somehow amplifies the physician's ability to interpret the CT scans. And it provides a rapid and consistent quantification of early brain damage. I guess there are a couple of people, like now, I don't know now, but like they were like 3 or 4 people just working in a garage, and like they were generating they generated very nice software. Another example is Transpera. This is also a deep learning-based model in software, which has shown to improve the mammography reading. So the performance was compared against, like in their clinical trials, they compared it to 12 human experts, and they showed that okay, they can be used, this software can be used as an assisting AI for the second opinion, but also it provides a score, transparent score, so there would be no need for double reading for low scores. So they try to somehow rank the patients and not to look into like the low rank, less important cases. The company is called Pinpoint, and I know that they are expanding their field, and now from mammography also they are moving to other applications in lung. And last but not least is the AIGeeks, and these are just going to extend. So they are going to do something that a human reader cannot do. This is a spin-off from University of Leuven and University of, I'm not quite sure, I guess Antwerp, yeah. So they back in Belgium, that it's called Icomatrix, and they have different products for CT images, for MRI images. This is based on the MRI images, and they provide the quantification on MRI images in order to to help with identifying and following up MS patients, in order to also identify dementia, and because like with the brain atrophies, it will help. And also I know them in person. They're 40. They are very hardworking, and they worked a lot towards FDA clearance, and they received it like a year and a half ago. So this software is being used globally, and I know that and it's cloud-based. So they wherever that has a contract with them, they just upload it into the cloud, and then they try to analyze the image for them. This is another statics. This is also a software that they try to quantitatively analyze the CT images in certain type of patients. So the application is kind of limited, and they started rather recently in 2016, and it's based on the deep model. But the very nice thing about them is that they are providing this service, which actually they show that outperforms the performance of like 5 or 6 human readers for free. So of course they are collecting more data to improve their model, but they also this software statics from Tirana company, they generates long reports. So the impact that I think that both the AI extending and AI assisting products have, like they are trying to somehow augment the performance of the treating clinician, or help them in order to rather than replacing the radiologist. So like with the neurologist, so like they're not replacing the radiologist, but they are helping the neurologist, they're helping the pulmonologist or the ophthalmologist. I didn't bring the example of actually the DeepMind with the research that they are doing with OCT images, but like the thing is that because they don't have a product yet, they don't have any FDA clearance or CE certification, but also they are just helping them. or like let's say pathologists, which is like, I mean, a recent publication of course, the Path AI, another company which I previously mentioned in my previous talk, that they have grouped with Philips in order to provide software that looks into the pathology, digital pathology images. But I think that, I also think that the AI assisting products, the IA, is going to become AIR over time with enhanced models. And so like, then again it's going to augment, to enhance, and that fear that is going to replace the radiologist is kind of not true, because the thing is that they are going to help, they are going to have more time to get out of their rooms and talk to the patients, or do some research with it, or like work on more complicated problems that they don't have time to work on. And like, it's not only with in Western world I mean, it's not only like in Africa that there is a lack of radiologists, but you can see that there is a lack of radiology in UK, also in Canada or other Western countries. So the fear, I mean, in my opinion, and it's my personal opinion, like that the fear is not really, the fear should not be there, and the positive impact of AI in healthcare is really promising. So thank you very much, and if you have any questions, I would be more than happy to answer.
Raise your hand. Come with the mic.
Hi, that was great. Just one thought I had. You were talking about a lot of the different areas. I'm just wondering what your thoughts are with GPs, like with AI, and maybe using that technology in terms of facilitating what a general practitioner do. Interested just to hear your sort of thoughts on that, and what the future might be for a GP, because right now it's so hard to get an appointment. The medical profession is so overstaffed. So we're thinking, okay, maybe AI or the use of that technology can help really facilitate that.
Okay. So to the best of my knowledge, at this time, the AI is not really somehow attacking their role, but like we have so with more automated workflows in order to assign like patient handling or data resourcing, maybe it could shorten the waiting time, but I don't think that is going to change the role of GPs that much, because you go to the GP and then the GPs refer you to a specialist. So, and then most of these models, they are actually trying to somehow mimic the performance of that specialist, not really the GP, because GP is more kind of just doing the office, but I mean the routine work, that trying to somehow figure out if this is the case that should be escalated to a specialist. But I guess all these models can help in order to optimize the workflow. And one use case that I always have, in order to not only for diagnosis but also for prognosis, in order to, or in the planning, in the predicting the market, predicting not the market, but in predicting what would be the future needs for the people, because the demographics change over time, and then try to identify, and also based on gene therapy, to try to understand what would be the future and then what would be the most diseases that will be out there, like coronary disease or cancer, different types of cancer, and in order to allocate different resources, and in order, let's say to decide that we need to train radiologists or a cardiologist or other specialists.
Do we have any projects on healthcare at the RBC right now, or is it just
No, No, unfortunately not. No.
The solution that you said, it's on the cloud and it's on, you can put a desktop or on the cloud. How do they address privacy issues when it comes to uploading data?
I may not be the very best person to answer that question. If you're asking about the ICO matrix, I don't know which one are you asking, but like I know that that at the point prior to uploading, there is an anonymization phase that like all the data is anonymized, and you will be provided with like a code. So yeah, of course there is like the key is always there, but yeah, but I don't really know about that infrastructure. But yeah, that's a big concern also. Of course, yeah.
I was wondering, how do you see the cultural acceptance, so to speak, of AI in healthcare? Because I would imagine if you compare to the financial sector, the banks jumped on AI. How does it work with healthcare?
So there was actually, like in my previous talk, I was trying to, I had a poll asking the people like, and I want to ask it again if you don't mind. So if you have time. So imagine that you have a very uncomfortable situation, like that you don't like, and you have three options to go and consult with the person. Like either it can be your doctor, or it can be a random doctor, or it can be a bot. Who would you rather go and talk to? So like, I would be happy if you could raise your hands, and if you prefer your GP to go to and talk to. And who would go to a random nurse, like I mean a random doctor who doesn't know you? Okay, no one. And then who prefers talking to a bot? Okay, some people didn't want to know. So yeah, it's like, I guess it's half-half, especially with embarrassing conditions. Like it's going to get, like we are going to get there, but like we are trying to get there to the point that to trust them. Of course, even like in radiology cases, like I mean, look into those images. There are also human errors over there. And the thing is that it takes some time, and it needs to show that it brings value, and it's like somehow the decision that the model is making is more accurate than the decision of a single person. And like mostly I wanted to emphasize that let's focus on the augmentation, like the assisting part, because for so many cases we need a second reader. Or thirdly, like there are some cases that they are like a second opinion is required, or I myself prefer to go to a second, like to have a second opinion. But also there is another study that is a cultural thing. Like even if for some people, if they know that the second opinion comes from a machine, they don't trust it. But it really needs, like it takes some time for people, like even for the very first doctors, for the very first female doctors in the world, it took some time to trust them. Yeah, sure.
So many of the cases that you show appear to be based on labeled data sets. Have you seen applications in which unsupervised learning is used
At product level, no. So yeah, that is the, like with deep models, there is the hope that we could move to problems that they are not known. But the thing is that like to the model, like I mean, it's new. But yeah, you are right with the soup. Like even like they are very case specific. Yeah, and that's the limitation. So most of the products that I showed, like they do one or two tasks. So yeah. Yes, sir.
I have more of a comment. So my doctor my history order. Right? So that's one. The other thing is a doctor also looks for biological or just based on information provided.
Yeah.
That way, especially there was a Shall I start again? So feel free to repeat it, what I just said. That's why I would prefer my own GP at this point.
Okay, yeah. You are correct. The thing is that for so many cases that the radiologist or a neurologist or whoever look into the data, they do not only look at that single image or that single slide of pathology, but they also have some information about the patient history, prior images also. So like some of these models, they somehow incorporate the previous scans, but like they have a, like they look into the family history, they look into the patient history, they talk to the patient, they talk about the symptoms. So yeah, also, so there are some products, there are some that under development that they are trying to use to incorporate all those textual information like the previous reports and everything using natural language processing and adding those information to the system. But yeah, you are correct.
I just wanted to add to that. There's a couple projects happening in Toronto, or basically in Canada. Canada's invested like $1 billion in superclusters, and healthcare is a big part of it. And also there's a couple blockchain projects going on to put your healthcare information onto the blockchain. So your information should be transferable like across Canada when that kind of gets going. I just wanted to just add that.
Okay, no more questions? Okay, thank you very much, Nassim.